What we are trying to accomplish during the handoff communication is to get the information that's pertinent to the facility so that there can be increased continuity of care and what helps the patient recover quicker.
Healthcare organizations know only too well that a poor handoff can affect patient care by delaying treatment, increasing risk of error, and contributing to patient and staff dissatisfaction, which results in inappropriate care. To help organizations measure and improve the effectiveness of their handoff communication, the Joint Commission Center for Transforming Healthcare has developed the Handoff Communications Targeted Solutions Tool, which is available at no additional charge to all Joint Commission accredited organizations. The Targeted Solutions Tool, or TST, identifies the specific barriers to improvement or causes for failure and provides effective, proven solutions based on those causes and barriers.
We looked primarily from ED to floor, and then from floor to skilled nursing facility. We send a tremendous amount of data before a patient is even transferred to a facility. So everyone's thinking, oh, this is great, we have enough information. But when we actually sat with the providers, they gave us feedback that no, it wasn't enough. We need real-time data and we need to know more about certain aspects.
There's been a tremendous improvement in handoff of the patients. We hear that not only from internally, from our staff, and we hand off from one location to the other, whether it's ED or the inpatient unit, but we hear that from our colleagues in the nursing home facilities that are getting the patients, that it's helping them tremendously. So at New York Presbyterian's Allen Hospital, we've seen about a 50% reduction in readmissions from the nursing home to the hospital. Obviously, that's something that the Affordable Care Act is looking for to help us reduce our healthcare expenses, and this project has been instrumental in our ability to do that.
Since we started implementing the TST, we've already begun to see the positive changes in communication between our physicians and the postgraduate trainees.
The data collection process was very, very simple. There were surveys that were handed out to the emergency physicians. There were surveys that were handed out to the medical residents. People wanted to express the problems that they felt were occurring with handoffs, and this was a great tool to use to express that.
When you're busy, especially in an emergency department, what happens is you focus on the problem at hand. And that can lead to a question regarding that problem, and that sets you off on a different trajectory.
The Targeted Solutions Tool for Handoff Communications will guide your organization through the entire improvement process, from building a team, measuring the current baseline, identifying specific causes, and linking those causes to proven solutions. In just 16 to 21 weeks after beginning your project, you will begin to see the results of your work.
Everybody has learned how to be a better giver of the information, a better sender of the information, how to be a better receiver of the information. And without this tool, this would never have happened. It's very, very simple, but it solved this problem literally in a matter of weeks.
Using the Targeted Solutions Tool for Handoff Communications will help your organization align the expectations of senders and receivers, develop a standard process for successful handoffs, foster better relationships and communication among staff, and improve your handoff communication using field-tested solutions. The Targeted Solutions tool is flexible enough to use in any setting and for any type of transition of care, both internal and external. One of its key features is the ability to customize for your specific setting.
Our readmission rates have gone down. The patients are being discharged quicker. The continuity of care as patients go from the hospital to a receiving facility has increased.
Our ultimate goal is to take excellent care of the patients and for the patients to be in a safe environment. And communication is key to all of that.